Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we're back talking about our Gold Neonatal Online Conference 2024. And let me tell you how excited we are this year. And I say that with complete sincerity. The information that is coming in and the research is truly so exciting. And I would say that it's shifting a lot of perspectives, things that maybe we've looked at before, but in a new light. So I can't wait for you all to join us, of course, online. You can head over to the website right now at goldneonatal.com. There you can look at the registration. Of course, we have our keynote coming up as well. You'll be able to join it. Everyone can join us for our keynotes. They're open access and free. And then you can look at all the amazing content that we have coming up. And that brings me to my very good friend and colleague here today, Manuela Filippa. Thank you so much for joining us here again at Gold. You
Thank
are
you for this invitation.
Oh my gosh. And we just had an opportunity to actually pre-record your presentation. And that's important to tell folks because it means that when the conference starts, folks will be able to register and get your content right away, which is really a blessing because they can dive in and get to work and start challenging themselves to these types of perspectives, which is, I think, is so important. Now, let me tell folks about your topic because I know you've presented here at Gold before.
Yes.
And it was a few years ago. This topic, titled Synchrony in the NICU, Navigating the Benefits and Challenges of Early Vocal Contact Between Parents and Preterm Infants. Now, Manuela, you live and breathe this type of, content. And so I would say, okay, we have to probably say you're completely biased, right? When it comes to this, because you're such a huge supporter, but your life's work has really taken on the challenge of the research to really know, is it true? Is this actually something that can change, the perspective of an infant? And I use the terminology like a human being is really changed forever, in the NICU, and we know that. But what can we do better? So first of all, tell me, like, what is happening in your world? How is your research going? What are you excited about this year?
Yeah, so thank you. Thank you for these questions. So as you said, I'm biased. I'm also biased because I'm a mother of a preterm baby.
Yes, yes.
However, I'm very happy to be in a strong research context where biases need to be avoided. So I
Yes.
have people around me encouraging me to avoid all the biases. And this is also thanks to the clinical, randomized clinical studies.
Yeah.
So we try to do really, really, really our best. But of course, I'm very biased. I'm very
Yeah.
biased because now the research we begin having a lot of results in the last 10 years. So the last
Right.
time that I was talking, we had some results, but now we increase the numbers of questions and the
Mm,
number of answers, and now we are trying to make also some guidelines, like some
right.
clear guidelines. And this is a bit the content of
Hmm.
my presentation. So, which are the challenges for preterm
Right.
babies, and how can we answer, and which are the guidelines and suggestions for the
Hmm.
practice, for the
Yeah.
clinical practice. So my research is a bit trying to make this bridge between the research and the clinical practice, because I think that this is really the final aim of a research project. So to have an impact,
Yeah.
and as far as this research can be helpful for parents, for babies, for practitioners, I'm happy. So
Yeah.
this is, I think, one message about my research now. And what is very exciting for me is that I'm collaborating, for example, with EEG experts, with NIRS expert in neuroimage in general, to open to a lot of measures these inquiries on human beings. So we have
Right.
to assume multiple perspective, right? To have some, I mean, to see how it works, how we work, which are the mechanisms, which are the benefits, which are the challenges. And so this is really inspiring for me.
Absolutely. And of course, a life's work in this area, the nuanced behavior that we've seen change an infant's brain, and really look at, what is valuable, what can reduce pain, what can, what a parent can contribute. Are we still stuck with the illusion that there are alternatives that are better? It just reminds me that sometimes parents, and not even forgetting that COVID really, has set back NICUs quite significantly, but that parents can actually instill fear because they are fearful, they're in the NICU, but the
Mm.
fear and stress from a parent can actually contribute to that. So therefore, clinicians don't invite them into the space. I mean, we know lots of parents are there all the time, but we know that we could do better. So can you tell me what some of the struggles are that we still have of inviting parents in? I mean, we've had this knowledge for a long time, Manuela, and I know it's even better now with your research, but why is it still so hard to invite parents in? Why is it that we struggle thinking that it's actually going to have a different cause and effect on the infant?
Yeah, I think that these kind of changes need a lot of time. So even if we have, even if we are convinced by scientific evidences, it
Right.
takes time to reorganize, for
Mm-hmm.
example, around the parents' needs. I recently visited a family unit in the
Right.
NICU,
Yeah.
and it was a mess.
Oh.
They had objects everywhere as a family lives. No,
Mm.
they had objects, they had clothes, and
Hmm.
this is life. So
Right.
the challenge is to accept that in our hospitals there is always there is even something that I cannot control completely,
Mm.
like parents living in a family room. And I found this room full of vitality. So
Right.
I mean, I perfectly understand that it's very difficult to change this perspective. But if
Right.
we believe that intimacy and the presence of the parents need to be at the center, we can be also ready to change something in our rules and in our expectation. But this is
Hmm.
challenging. This is challenging. And for example, regarding pain, in my presentation, I talk about the effect
Hmm.
of being there for parents, being there during painful procedures, and I was also afraid at the beginning that it was too much for certain
Right.
parents meant to be there.
Yeah.
So the first thing is to ask if they want to. They are
Hmm.
not obliged to be there, but
Sure.
they can try.
Hmm.
And once they tried, at least for this experience, they want to be there. So the first step of inclusion is hard to do, but then we have parents with gaining confidence,
Right.
I mean, also the desire to be there. And
Hmm.
we have a new colleague for our care in the NICU if
Hmm.
parents are there, because they can really help us. For example, in these painful procedures, if parents are concentrated on the baby and are really talking to the baby, and we have a more stable baby, the painful procedure, the blood sample will be easier.
Yes.
So, so these are few steps that can help the parent inclusion in the everyday care in the NICU.
Mm. I'm really excited also just to, acknowledge that when a parent is first exposed to the NICU, it's very overwhelming. And they may even have that sense of wanting to not be there, or, just you take care of that situation. It's too overwhelming for me. But we see what happens, when there's a lack of bonding and a lack of time together. There's a deterioration in both humans, when there's a separation at any given time. So it might seem obvious to a lot of people listening in, and to you and I, we know that there should be zero separation, but putting all those pieces together, it still feels like we're working with some silos within our NICUs, within our parents, because we need to educate our parents to get them in there. We need to educate the staff to know that this synchrony can only happen when they're together, so that we can get those outcomes. When do you think some of these silos, you talked about the research catching up. I'm so impatient. Honestly, Manuela, I just want it to be all so fluid and, have education for everybody and so forth and so on. Tell me about some of the exciting things that you have seen, that have been changing, in your time, that have, where people have really bought into, this is how we do things now. We don't have to hold on to the past anymore.
Mm, mm. So this is, for example, I saw some really good changes with the video feedback technique. So when
Oh,
parents can see themselves
right.
acting,
Ah,
and they can see the baby's responses, and they can learn to read their baby's
right.
responses to these video clips.
Yes.
So this video guidance is something linked to the education, but linked
Hmm.
to, I mean, we don't need to change huge things. Maybe sometimes we only, things are silent. We only need to leave them to come to the surface.
Right.
Like Michelangelo and his
Yes.
sculptures.
Yes.
So the Michelangelo didn't create something new, but just took off and
Hmm.
leave what was inside to exit. This was his
Right.
philosophy, and this is something that I really, no, it's something that for is a metaphor that for me was really useful. So when I see the changes, is then when parents really exit
Hmm.
and things and for example parental behaviors that were silent finally grow and act and go
Yeah.
to actions. So this was something and that leaded to, for example, change in our NICU, and parents wanted to be there during painful procedures. So parents
Mm.
who stayed a bit off were active and actively participating in these difficult periods with silence. So this was a change. Of course, change are not macro change, are micro,
Right. Yeah.
right?
Yeah.
So I expected the huge changes, but I mean, we have to expect micro changes,
Micro
but
changes.
if
Yeah.
they happen in families, these are
Hmm.
long-term changes because they continue over after the hospitalization.
Sure. Yeah.
So these are interesting changes that can continue at home.
Mm, yeah, that's beautiful. That's beautiful. Wow. I'm telling you right now. So of course, I have had the opportunity to listen to many of our presenters coming in already. Your presentation just fits like a glove with all of the others, that are happening right now as part of our conference and our event. I know for our viewers, when they start to see and be able to put all the pieces together, I love that you said that these can be micro changes and they really do transcend into the home and into the future. We're talking about, how NICU babies are really, it's the first 2 years of life that really they're impacted, and it can be lifelong. So that's what we're really looking at today, in terms of development. This is fabulous. Thank you so much for your continued research. This presentation, I promise you listening in right now, is going to take your practice to a whole new level, and have that awareness. These are things, again, that are not hard to implement in certain aspects. Like you said, these are micro changes that can have a huge impact. Thank you so much for being here today, Manuela
Thank you to
Filippa. Thank you for
you.
your work and your dedication to this field and this area. It is so great to hear all the things that are happening. And of course, to all of our viewers, just a quick reminder, head on over to the website right now. You want to get all those details right away, goldneonatal.com. all the times of when the presentations are coming up. And of course, Manuela is going to be here as part of this conference for this session. So thank you again for joining us. Have a wonderful rest of your day. Bye-bye for now, everyone.